Hi, everybody. Um, can you give me? Oh, thank you. I was just going to ask if you can give me an indication if you can hear me and see the slides. Can everybody hear me?
Yes.
Yes.
Okay. Okay.
Yes.
Okay. So if anything happens, like I get cut. Me. Okay, we've got 1 minute, so we'll just wait for 1 minute before I start. Okay. Good afternoon, everybody. My name is Dr. Shaheena. I work at Intercare Health Center. So we're all aware that this is Autism Awareness Month, and I hope that the information that I actually share with you will be helpful in some or other way. If you have any questions, you'll see me writing down some things as well. If I see any questions or hands up while I'm talking, so that I don't actually forget anything. But let's start. Okay, so from understanding to action, supporting children with autism in the classroom as well as at home. And with our current situation, and I hope everybody is safe and well, we can understand why it's important to give some advice or guidance on how to actually help children or help parents who have children or family members who have children who are on the autism spectrum, especially since a lot of homeschooling has been going on. So I'm going to actually start with giving a bit of a breakdown on what autism is. And the reason why I've actually included it is because in order to reach out to children or people on the autism spectrum, I often find that it's important to understand what condition or what areas of development we need to give attention to. Okay, so we have to bridge the theory to our practice. And what is it? Because a lot of people and parents ask me, what is it? Because they've never heard of this condition before. Okay, and I want to when I say condition, I'm actually talking or trying to keep my terminology as updated as possible. Okay, so when I say I'm talking about neurodiverse thinking, okay, and learning. So autism spectrum disorder is a neurodevelopmental condition that affects how individuals communicate, interact, and process information. There are key differences in children or people who have autism spectrum disorder are the differences in social communication. There's a different way of communicating socially and a different way of thinking about socialization, okay? There is restricted or repetitive interests and behaviors. We often find people have specific interests. We call it a professor syndrome in some neurodiverse thinkers because they are obsessed with certain topics and they only talk about certain topics and they have a lot of information about that topic or specific interests such as painting or just about dinosaurs. And then sensory activities. We often find that people on the autism spectrum have a different way of perceiving sensory information. So a door closing may be exceptionally loud for a person on the autism spectrum, whereas it can be an ordinary sound for us. It could be extremely elevated for them. Sometimes they don't even hear it or respond to it. So we really need to be perceptive about how we look at the sensory makeup of people with autism. One of the things that, and I've given therapy and come across many people on the spectrum, and there is no one size fits all. Okay, if you've seen one person with autism, you've just met one person with autism, because every individual's makeup, just like ours, okay, is completely different. And that is why we emphasize individuality and individual therapy programs, as well as individual um, teaching programs, because every child's needs is different. Okay. So here again, in the past, they would call autism a triad of impairment, which is what makes it, and I want to emphasize this, which is what makes it extremely difficult for professionals and parents and caregivers to understand, because it's not just a language or communication a difficulty or diverse way of learning. It's also about the social interaction, as well as rigidity in thought and behavior. Okay, this is really important for me to emphasize, because I often see that people work on language and communication, and they work on the social interaction, but tend to forget that this is a neurodiverse learner that is very black and white in thinking. Okay. And sometimes you see certain behaviors, and I hate calling it behaviors because it often sounds so negative, but you see certain behaviors when there are changes, or if they have to do something suddenly, and you think, oh my goodness, why am I having a tantrum? Why is this child having a meltdown? And it's because we as professionals have, or parents have forgotten that in their mind, that is a black and white thinker, they've prepared, okay, for one thing, and suddenly it changes, and it's really difficult for them to adapt, because they've prepared in black and white thought for a certain thing to happen. Okay. There's difficulty in imagination and difficulty in abstract thinking, and this influences the social interaction and language and communication development. Okay, so let's look at the common strengths of people with autism. There is a very strong visual and rote memory or attention to detail. Often you will get parents who will say, wow, but my kid does not have a language or communication difficulty because he knows his nursery rhymes. He can tell you all of his nursery rhymes, or he's learned the song off by heart in from television. And that's fantastic. But then, as a therapist, as a speech therapist, we have to go a bit further and gently ask the parent or the teacher or the caregiver, can he use those words in a different context? Okay. And often a red flag is no, you can't take the same words and use them. Okay, I hear someone in the background there. Okay. Okay. They are very logical and structured thinkers. Okay. So this is where you get your analytical thinkers. Okay. And often we joke about engineers who are very logical thinkers and analytical thinkers. It's just as a joke. Okay. Deep focus on specific interests. As I said, the neurodivergent learner or thinker may actually have a specific interest that is intellectual, and they will have an incredible knowledge about this, okay? So we can use this as a strength, right? Honesty and reliability. I find it very difficult in my experience to find people on the spectrum or neurodivergent autistic people who can lie, because it's black and white, and it's either the truth or it's a lie, and it's not good to actually be dishonest. If that's the rule, that's the rule, okay? And we can use this as a strength. Unique perspectives that enrich the classroom community. And there are some times when I am really taken aback by what the neurodiverse person on the spectrum may actually perceive the environment or experience something. Attention to detail. If I put a picture out, sometimes they will see something that I have not seen, and I've used the equipment for a long time. So we can use that as strengths. So the challenges that they may face is understanding social cues or group norms, okay? We often find this difficulty in socializing. On the higher end of the spectrum, they don't pick up on nonverbal behavior or nonverbal cues. For example, if we are late, we'll often look at our watch to have a look at the time. I will pick it up. Okay, this person's getting irritated with me talking all the time, but and perhaps they need to go. But a person and a person with ASD may not pick up that cue. Okay. Difficulty managing sensory overloads, noises, lights, smells, textures. I had a client the other day who was really turning his back on me, and I wondered, okay, what could be the matter? And then I realized, okay, the perfume that I was wearing, he was averse to it. Okay, so we have to also be quite sensitive to what their sense of smell is like. Perception is like depth perception. I mean, sometimes a person will stand on the top of the staircase and you'll think, okay, what is going on? And then you realize there's issues with depth perception, okay, because walking down the stairs requires us to believe that we're safe, that we can put our feet on each stair and go down safely, okay? How deep is that stair? How far do I need to put my foot down, okay? Communicating needs or emotions, okay? And often when we look at a baby will cry, and then you will say as a parent or a teacher, okay, well, let me try and see, is it a nappy? Are they hungry? Are they tired? Do they need to go to bed? So again, a person on the spectrum may really have difficulty expressing their needs as well as their emotions, okay? Think about it. Emotions are abstract. How do you explain happy? How do you explain sad? Okay. How do you explain embarrassed? It's a difficult concept to explain. Coping with transitions, changes in routines. As I explained, a person who has an idea of what they want to do and suddenly there's a change and it's difficult for them to actually make changes may have a meltdown, okay, or suddenly exhibit a tantrum, okay. And I'm giving you very vague examples, but it may not be that bad. Sometimes a child's mood may actually just change, or avoidance will happen. Executive functioning, and this is very important because in the autistic population, what is really difficult to achieve is executive functioning. In other words, doing a lot of things and processing a lot of things at the same time. So yes, there is language development and progress in language and communication. There may be progress in socialization as well as rigid thinking. But putting it all together at the same time is something that we as therapists and parents would need to guide them on, because it does not happen automatically the way it will happen in a population where there is just a language delay. Okay, so let's get to how can we help and create an inclusive environment. And when I say an inclusive environment, I mean in all environments. Okay, so I just read, I think it was yesterday, that Etihad, no, sorry, it was Yas Mall, has now got a sunshine program going on that is making shopping an inclusive environment for neurodiverse people. And I think that's fantastic because they've taken that environment into consideration. So inclusive environment means applying it in every environment, whether it is in the classroom, whether it's on the playground, whether it's at home, whether it's in speech therapy, or even at the mall, at the airport. I see even the airports now, with our situation, have made a concerted effort to help people on the spectrum. Okay, and that is inclusion. Okay, so generalizing everything you've learned in therapy to the classroom, to the playground, and to home, and vice versa. Okay, let's start basic. How are we going to do this? Okay, we're going to try to implement and use clear, consistent structure and visual schedules. Okay, number two, provide predictable routines and transition warnings. And we're going to get to a lot of this later in a little bit more detail. Make class expectations visible with visuals. Offer quiet spaces for self-regulation and foster a positive and accepting classroom culture. Okay, now I know in a lot of the schools that I actually go to, we have this, okay, but it needs to go a little bit more deeper. Okay, so I know a lot of people may ask, okay, why visual over verbal? A lot of people say to me, Shaheena, you keep going on about visual, 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 visual. Okay, but there is really a theory to this. There is really a method to this madness. Okay, so this person that you see on my slide is actually Dr. Temple Grandin. Okay, and she was one of the first, a long, 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 long time ago, because I know some of you are the age of my kids. Okay, it was difficult to diagnose autism spectrum disorder, and she was one of the leaders because she has the neurodiverse thinking, and she paved the way for us to actually understand people on the spectrum. Okay, so this is who she is, and she started off, many people have watched her movie. There is a movie. Please, I recommend that you go and watch this for a better understanding. She was a child who was nonverbal with severe sensory regulation issues, okay? And she said, I am a visual thinker, okay? Even the guy who wrote, the person who wrote Alice in Wonderland says, I think in pictures. Okay, because this is how the brain works. Okay, and there is a theory to this. Okay, and if I show you the brain scan, okay, this is her brain, which she has allowed everyone to actually see, right? If you look at this brain scan in the control group, you will see the blue line, okay, going to the back of the brain, okay, and around the auditory areas of the brain, which is where we as non-neurodiverse people actually process information, right, by the word. If you talk to me, I understand, okay, in English, okay. If you look at Temple Grandin's brain, okay, which is a representation of neurodivergent people on the spectrum, that information is processed at the red line goes right to the back of the brain, okay, where that is the visual cortex, okay. So when I recommend to parents and I recommend to people Please, let's change this information to visual information, okay? There's method in the madness because research is telling us that this information is being processed in the visual part of the brain, okay? So this is important for us as therapists, parents, and caregivers and teachers to actually understand. Because when we are talking and communicating with children on the spectrum, we are only using words most of the time, right? How much information are they actually missing out? And suddenly we're expecting them to actually understand everything that we say when their brain is processing everything in the visual cortex. That's not, that to me, as therapist, is not really including them in our environments. So a lot of people will say to me, well, then how do I communicate and teach my child or the children in the classroom who have this way of thinking and processing information? So recent research is showing, and the term that they use is visual immersion, okay? We need to immerse our classrooms, our playgrounds, our homes, our the airports with visuals, right? Okay. On playgrounds in some schools, they have a lot of visual cards that children who are visual processors can actually take and communicate. In the classrooms, I often see there's a visual schedule, okay? But there's a little bit more method to this madness, okay? We need to ask ourselves, what type of visual are we going to use? Because not all children on the spectrum are the same, like me and you. I like big handwriting. Another person may like smaller handwriting. I prefer to people to speak a little bit loudly to me so I can hear clearly. Other people prefer softer speech. So just by using that example, okay, people on the spectrum may prefer an object-based schedule to understand, a picture-based or photograph schedule, a line drawing, written schedules, or visual-based schedules. Okay. And this is really important because sometimes you will have a line drawing schedule and it's not working. So we have to ask ourselves, okay, well, how is this child processing information? Does he actually need an object or a photograph instead of the line drawing? And if we change it by trial and error, we may just be spot on that he or she may actually need an object to communicate. Okay, so I need everyone, whether you're a parent or a clinician or a teacher, to try and see at what level of processing is the child. Because if a photograph's not going to work, you're going to try an object. If a line drawing is not going to work, you're going to try a color object or a photograph. And that's how therapists actually get children from understanding a concrete object and what it means to the word. Okay, so now there's a lot of information on these slides, and I'm not going to go through it all step by step, okay, because there's a lot that we need to get through. But just by these picture examples, you can see here that I've got an example of objects that are real and tangible. So if there is a child where you want to say, go brush your teeth, okay, or it's time to brush your teeth, they don't understand the words, you can give them the toothbrush if they don't understand the picture symbols. And then they will understand, okay, a toothbrush means it's time for me to go brush my teeth, right? Okay, there's other examples. Okay, I need to cut my nails or I need to shave, okay? Then we move on to photographs, Okay, if a child is understanding the objects, we can try to introduce photographs. And here is an example of photographs of a child's schedule, okay, where you have circle time in a photograph and all the kids in the classroom are sitting in the circle. And when it's done, you can tick it off. And then you've got the next thing that they need to do. Then they go to the playground. Then they have teacher time or whatever else activity. Okay. So you can take photographs. And a nice little tip for that, particularly parents, because now we're going to say, okay, I know I've been through this. Okay. Oh my goodness, where are we going to get a camera from? How are we going to. There are these new Insta cameras that are out. Okay. And it's like amazing because what it actually does is you can take a photograph of the child walking on the beach there and then. Boom, take the photograph, and like in like 2 minutes after it's developed or something, you've got the actual photograph with you that you can use, at that time. Okay. The child in a restaurant, the child at the school. Obviously, in the school, we would have to work through all the red tape and ask permission from parents to take photographs of the child and use it for communication and curriculum purposes. Okay. So, for example, if you want the child to write and there's usually avoidance or it's just a schedule, you can take a photograph of the child while he's writing. And the next time you can say, look, it's writing time. Okay. And then we've got the line drawings. Okay. Look at the colors. I've had some children who do not even like the colors that I've put on schedules. And I've wondered why on earth are they not responding to this therapy? And then I had to change the colors. And I'm like, oh, okay, cool. Right? So there's a lot of trial and error. Okay. And that's why they call people on the autism spectrum, they have a puzzle. It's like figuring out a puzzle because the way they perceive the world is very different from the way we perceive the world in terms of their senses and even their visual sense, their vision. They perceive things differently or may perceive things differently. Okay. So consider that when you are actually making schedules. Some children actually need big pictures. And I'll walk into a classroom and there will be these teeny tiny pictures. And I'm thinking, I can't even see that. Okay. So let's adapt this. And it's not criticism, it's just adapting. Okay. Because me as a therapist, I also do things and around, oh, oops, I should have done it another way. It's about learning and adapting our classroom to suit that particular child's needs. These schedules can be made and used at home, okay, for routines and rituals at home. So again, visual over verbal. Here is a book of symbols of, for example, these are Makaton symbols, okay? A lot of you have heard about Makaton, and this is a combination of photographs and Makaton symbols on to explain to the child what they need to do. So going to school, I need to have my breakfast. I go to school. And this is an example of Makaton pictures and the Makaton symbols. So when I give therapy to a child on the spectrum, I use Makaton, I use the word, I use the visual photograph or black and white drawing. I use my face, I use every visual that is around me that I have access to, because I need to immerse that child into visual learning to get into those pathways so he can process the information that I'm giving him. Okay. So here is an example of schedules that have been set up in a classroom. Okay. The picture of the children on top, I have permission to use these pictures, so everything's ethical. Okay. The pictures of the children in the classroom are actually on top, so the children actually know who that schedule is for. Okay. The schedule is placed, the children set up their own schedules. Eventually, they learn how to set up their own schedules. What is on Monday? What is on Tuesday? What is on Wednesday? If an activity is done, they take it off and they post it into the finished box. Okay. Sometimes Peter's schedule will be different from Sam's schedule on a Monday because Peter needs to come to speech therapy and he will have speech therapy on his schedule. And Sam comes to speech therapy on Tuesday. Okay. So this is why it's important to realize that while we have a classroom schedule for all the children in the class, we also need to have an individual schedule. Okay. So I can use the example of to work. So what do I thinking? I am a speech therapist. John is an engineer. Okay. So the way we work and the activities that we need to do are very different. Okay. So while each child has a classroom schedule, in English, Sam needs to do verbs on a lower level, whereas Peter needs to work on his adjectives, okay, or do the verbs on the class level. Even at home, even in school, in the classroom, the schedule actually needs to be individualized and needs to be accessible to the child, right? So we can put the schedule on that particular child's table or on a board next to the child. Okay, this is an example of the way a table and chair in a classroom has been set up, okay, to help children focus on their work, okay? And when I talk about teach program later, soon, you will notice that this classroom has been set up that way, okay? So we've got task 1, 2, 3, 4, 5 that we need to finish in little boxes, okay? And you don't need anything fancy. You need task boxes. And this is for parents as well. You've got English, you've got math, you've got Arabic, then you've got break time. Task box 1, English. Number 1 is English. Number 2 is math. Number 3 is Arabic. Okay? It's easily accessible to the child. Eventually, what happens is the children start working independently because we are focusing learning on their strengths, which is routine, right? They like things the same. They're rigid thinkers, okay? So we're using that rigidity and that strength, we're making it into a strength to get them to work independently. So parents can set this up at home. Like in COVID time, it was so important for us to go into homes to set this up because there was a lot of it was homeschooling. Children were at home, like now, and they need to learn to work independently because, of course, parents are working as well and can't sit with them all the time. Okay, right, for home schedules. Because we need to also reduce anxiety and we need to know what is expected, okay? We have a calendar like January. Every school teacher has a calendar, right? Every parent has a calendar. Oh, on the 17th, it's swimming day. On the 19th, it's sports day. So it would be really good and reduce anxiety and meltdowns when there's a change in schedule. If you have a January calendar and you can put pictures of swimming day, or no, it's birthday, or oops, I use an exclamation mark when there is like something happens. So for example, oh, today is our swimming gala. Oh no, it's raining. and I put the exclamation mark onto the swimming picture. Say, oh no, it's raining, we can't go swim. Just to explain to the child that, uh-oh, we can't go swim. There's a change happening, but it's okay. We're going to make a plan. Okay, we're going to go to the gym instead. Okay, and then we've got a morning schedule here as well. So for parents, if you can see Jake's morning schedule. Jake needs to wake up. We've got the alarm clock. Okay, he gets out of bed, he puts on his robe, then he goes to the bathroom. Then there's a bathroom schedule. He goes to the toilet, he washes his hands, he dries his hands. Then there's a changing schedule. Okay, so I would often recommend a task analysis, visual task analysis. And when I say that, many people will say, yes, but I have a schedule. And I'll say, yeah, I get it. And that's fantastic. But we need to break down tasks so that children can understand how to be independent. Okay. So giving them visuals, step-by-step visuals on how to do things, because it does not automatically come, and executive functioning does not automatically happen in children with autism. We have to help them achieve that. We have to help them get there. Okay. Okay. So I'd like to discuss, I've got 10 more minutes, but I'd like to just really discuss this program, which is Teach. Okay. And I'd like to apologize for the terminology, but the Teach program was actually developed a long time ago and is still in use because it works, right? And nobody is reinventing the wheel. We don't want to reinvent the wheel because this way works and has been working for a long time. So excuse the terminology, but it is teaching and education of autistic and communication handicapped children. So we don't use handicapped anymore. My apologies, but this is what they named it yonks times ago. Okay. So this is structured teaching. And one of our strengths in people who are on the spectrum and who are neurodivergent thinkers on the spectrum is that they need structure. Okay. Structure and predictability. So yes, let's use that to get them to learn. And this is based on organizing the environment, developing appropriate activities, and making individuals understand what is expected of them. Okay? So here again, this is the structure of the home, right? Your child needs to learn. He's doing home or he needs to do his homework. We can cut off distractions. We can put his schedule in front of him, and we can have task boxes, okay? And we can also have a motivator, right? So if you look at the bottom diagram, it's got the teacher parent. The work is presented from left to right. You've got your task boxes. You've got a motivator. So you take a task box or the activity from the left-hand side. In the middle, you do your task. When you end, you post it in a complete. Okay, I've completed this. Okay, and then they can get a reward, right? So we're using structure and a structured way of teaching and setting up the environment to get children to be independent. Because often, let's face it, in the classroom, you've got what, 20 other children? Okay, 20 other children that you have to spread your attention to, right? And at home, you may have other children that you need to give your attention to when you are doing their homework, okay, or helping teach them, like in times like this. So by adapting the environment and giving a structured schedule, we are promoting independence. So you can leave that child to do their work independently, right? Okay, so here again is an example of structure. You've got the structure, you've got the table, you've got the tasks to do on the left, And then you've got the tasks that are finished that he'll put in the blue box on the right. Okay. Again, a classroom with activities that and boxes that the child needs to do with his visual schedule, right? So we can adapt homes, we can adapt classrooms, we can adapt offices to make it an inclusive learning environment. Okay, so I just want to touch on why task boxes, right? So they're versatile and customizable. You can put your tasks in, you can change them another level. Encourages mastery of the skills. Easy to organize and manage. So you as a teacher or parent or therapist, oh, we don't need to run around looking for things. Okay. Structured learning, which I've emphasized. It supports diverse learners. You can have different levels of task boxes, right? It builds routines and consistency. Okay, and we're using the strength of having a routine and the need to have consistency to teach them to learn independently. It is engaging and hands-on, and most importantly, it promotes independence. Okay, so that's just another visual example. Just some tips: make the task intrinsically motivating. So you can add a special interest in there. So when the child is done, you can either use that special interest to motivate the child, or at the end of when the task is done, you can give the child, say, 1 minute. You can play 1 minute with your dinosaur and put the timer on for 1 minute, okay? Because you've done fantastic, okay? Break the task into achievable steps. Again, visual task analysis, okay? And you can even measure if he's done step 1, if he's done step 2. Oh, yeah, he needs help with step 3, okay? Make tasks more concrete. Again, use visuals, visual instruction, because using verbal instruction is using the weaker processing side, not their strength, okay? Ensure that a task is achievable, okay? We all want to have a sense of achievement, okay? And they need to be rewarded. I just need to say this, okay? First and then, everybody seems to love this, but this is not a schedule. So if I go into a classroom and everybody says, yes, I've got a schedule, and then they bring out first and then, that's not a schedule. That's just telling me and a child, first you need to go to the toilet, and then you need to go out to play. That's not a schedule, okay? A schedule is a lot more in-depth. That's just guiding them on what they need to do, moving from one task to another, maybe in transition, helping them with transition. Okay, a reward system, an example of a reward system, okay? I am working for 5 snail stickers. When I get 5 snail stickers, I will get a snack, or I can get to swing, or I can get to use the computer, and I can get to build my favorite puzzle, okay? Now you're not going to say, okay, I will give you an ice cream if you pick up the pencil. The child's the whole day at school. Every time he picks up a pencil, you're going to have to give him an ice cream. Let's be realistic about our rewards, and let's be realistic about what our goals are, okay, and what we're using as rewards. Okay, so let's go to communication strategies. I'm going through this very, very quickly, okay, so we have time for questions. Use simple, direct language. Okay, keep it simple. Okay, we don't need to use words like supercalifragilistic. No, just keep it simple. Okay, keywords. Okay, pair your spoken instructions with visuals or written cues. Pair the word, your spoken instruction, with a picture or a photograph, or even I use the sign, the Makaton sign. Okay, allow processing time after asking the question. Give them time. Okay, it may take a little longer for them to understand what is expected. Check for understanding, okay, gently, okay, not by embarrassing them, especially like children on the higher end of the spectrum. you may find that they are aware that they do not process things as quickly as the other children. Use social stories and role playing for social learning. You can act it out. Okay, I often use role play in speech therapy. Supporting sensory needs. Identify triggers. Okay, sometimes a child may at a certain time in the classroom start having a meltdown. Maybe it's lunchtime and he can hear or he can smell something that goes past every day. The wheels of a trolley or a cart may be affecting him that goes by every single day at the same time. A noise, maybe the lighting changes, okay? Noise cancelling headphones can be used. Fidget tools as well as soft lighting. Allow movement breaks. Respect the need for space or quiet time. Sometimes we all need time out, okay? So we have to teach them to say, I need a time out. I need time to be quiet. We can give them their 5 minutes of quiet to regulate and then come back to the task at hand. And it's very important to consult with an occupational therapist for the sensory strategies that can be used, such as brushing, such as whatever activities. The deep pressure often is amazing. Okay, we often want to touch children on the autism spectrum by holding their hands. They don't like light touch, in my experience. They prefer deep pressure. That's far more comforting and relaxing to them. Parents will often say, oh, my child loves hugging me. Yeah, because he likes the deep pressure of that hug. It's comforting. Okay. This is an example of a sensory toolkit. So you can have the sensory calm down toolkit designed by your occupational therapist, depending on the child's needs and what is dysregulating him in the car, in your kitchen, in the classroom. Okay, you can carry it with you in your handbag, right? There's bubbles. There can be a vibration toy. They can be a squishy cushion, things as well as picture symbols that can help them calm down and regulate themselves. This is an example of calming down. Visual task analysis. What do I need to do when I calm down? Okay, this can be included in the house, in your handbag, you can put Velcro on the back of the car seat and then stick this schedule on the back of the car seat so they know what to do if they become dysregulated or become upset with something. Okay, behavior as communication. Behavior is communication, right? And that's why I dislike the term, oh, look at this child's behavior, because it sounds so negative, like they've stolen something, or it's like a juvenile delinquent or something. But remember that the behavior is communicating something, and always ask yourself why. So you look for patterns and triggers rather than punishing the behavior. Use positive behavior supports and clear expectations, okay? And reinforce the desired behavior consistently. And teach self-regulation skills, okay, like the visuals, and use zones of regulation, right? So I'm not going to go into this because this is a lot of the psychologist's job, but you can also use the ABC of behavior and determine the reason for behavior. So the antecedent behavior and the consequences. Is it a sensory reason? Do they have hyperactivity? Do they lose focus? Is it a lack of structure and predictability? Okay. Are they avoiding because they don't get praised enough? You need to ask yourself these questions on why children are behaving the way they do. Okay. Then we've got social stories, right? We all have been exposed to social stories, but I'd like to say that a social story is there to explain a social situation, not to help with behavior. What we have for behavior is contingency plans. Contingency plans are visuals of a modeled behavior of what you would like the child to do versus what they should not do and what the consequence of that would be. Okay, so that's an example. I sit at my desk, I do my math, and then I can dance. That's my reward. If I walk around the room and bother my friends, then I can't dance and I won't get my reward, right? Okay. Reduce sensory, basically this is just summarizing what I've said. Reduce sensory distractions, provide individualized support, allow the use of assistive technology. AAC is incredibly important in children or people with autism spectrum disorder. Peer buddies, you can pair them with a peer buddy. These are also research, evidence-based strategies, and celebrate your small successes. Small things are big things for them. Collaboration is key. This is so important. We have to work as a team, okay? The parents and caregivers, special education staff, speech and OT, psychologists and counselors, the LSAs, we are all part of the team and we all need to be on the same page because the ultimate goal is not about you and me. It's actually to help the children, right? So we can all put our different opinions aside and get one structured program to help this particular child. Okay, and trust the process. Any person that tells you, I will fix your child after 10 sessions, your child will be 100% normal, is lying to you. Okay, therapy is a process. That's why it's called therapy. And that's why we're not doctors. We don't give antibiotics and we don't give injections to make you better after a week. It's a process. And your individual child will help us and will show us how hard to push, how far to push, and when to actually make that progress. Right? Okay? So teamwork is super important. Okay? And then, of course, building awareness and inclusion. We teach, we use different strategies to encourage diversity, we encourage teamwork, and we celebrate everybody's strengths. There's some helpful tools for you here. A nice book is The Reason I Jump and Uniquely Human by Barry Prezant. Okay? And those are the references, our key takeaways. Every child is unique. No, the individual. Okay. Structure, predictability, and visuals are essential. Communication and collaboration are central, and small changes make a big difference. So this is just celebrating our Autism Awareness Month. And remember that every parent has their own journey, and sometimes they may be angry at us, but that's also part of the journey. Okay. And it's also important for us to present evidence-based strategies. Okay. And that is it. We've got some 10 minutes for questions. Okay, does anyone have any questions? No? There was a lot of information that I actually gave. Do you have any questions? Let me just see here. Okay. Okay. If you would like to ask me something that is confidential, if you're a parent and you would like to reach out about your child and you think it's personal and confidential, okay, you can ask the clinic for my email and you can email me and I will get back to you, okay? So I don't see any questions. So I hope that that was informative. It's a lot of information. Yeah.
Hi, Ms. Shaheena. May I ask a question?
Yes.
Thank you very much. First of all, it's very informative and thank you for your time and information that you shared with us. I have an artistic daughter and she is 5 year old. My question is regarding stick to routine. She follow routine very strictly, but something in real happens and it's difficult for me to handle her. As I told you a story, she is going to school by bus and she is going with her sister. She used to go like how she go with a bus assistant and every day. What happened one day, her sister forget her ID card and she came back home to get this, and meanwhile the we asked her to get in the bus until her sister back. So she was like anxious, little crying, she don't want to
Yeah.
get in. So these type of real things happen for me with her. So is the area of work, can you tell me at which area me and with her therapist should work on with her, make her more usual with these things?
Okay. So what what I would recommend is, do you have do you have a visual schedule of her going on the bus?
Yes, we
Okay.
have, and she
Okay.
understand it well.
Yeah. Okay. So in the case, I'm using the example that you've actually given me. Okay. So in that case where there was a change in routine in the bus, I would use an exclamation. Okay. She needs to have an exclamation sign that says, uh-oh, or something that she understands as, oh no, it's going to be different. Oh no, something has happened. Okay. It could be a cross, like a no sign. Okay. It could be um, the exclamation mark. Okay. And we need to teach her that that exclamation mark means, oh, there's going to be a change, right? And then we need to prepare her for the change by teaching her how to be calm when that change happens. So you can give her the exclamation mark, okay? So whenever something in real time happens, okay, you show her the exclamation mark. Uh-oh, we're not going to the shop now because it's closed. Uh-oh, it's late. Oh, look, it's raining. Then you show her a visual of the alternative. We will go to gym, or we stay indoors, we're going home, um, and give her a calming kit. So you're going to make up a calming kit on something that's going to keep her calm. For example, if looking at bubbles starts keeping her calm, you're going to have bubbles. You can carry bubbles in your handbag, okay? Or the bus driver can have bubbles, or the LSA can have bubbles, whoever, the class teacher can have bubbles, or the squishy toy that keeps her calm. And in that moment, she needs to be able to have access to all of that so that she herself can regulate herself and keep her calm, because it's real time changes that are happening. So in summary, I would give her the exclamation mark. I would work on her understanding that, uh-oh, things can happen. Change is going to happen. Okay. It's okay. And we can be calm by looking at the bubbles and using my squishy ball, or maybe she would want deep pressure, you know, that you can carry with you, or in the bus or in the classroom. That would help regulate her during her anxiety. Because a meltdown or that tantrum is actually anxiety. It's actually expressing anxiety. I don't know what's going on. I don't know what's going on. Does that help you? I would use a lot more visuals to explain that it's okay if something doesn't go according to plan. It doesn't have to. In life, things don't happen according to plan. And that it's okay. We can calm down and carry on our day. It might take a time for her to understand that, but that's what I would start working on.
Thank you. Thank you.
It's a pleasure. Okay. Anyone else? as I said, if you feel that there's something confidential that you'd actually like to share or ask about, you can email me, and I'll certainly try to assist wherever I can. Yeah. Thank you for everyone who attended. Thank you for your time. And learn something. There's always something more to learn. Nobody knows everything. But thank you so much for joining.
Dr. Shaheena.
Pleasure.
Thank you so much, Doctor.
Thank you.
Thank you so much.
Bye. Bye, guys.
Bye.
Thank you so
Thank
much.
you, Shaheena.
Doctor, thank you.
Pleasure. Pleasure.
Thank you.
Bye.
Thank you.
Thank you.